Hi, I'm Lisa Blahoski Olivares. I am the Public Health Director for the Mille Band of Ojibwe. As most of you know, the coronavirus, also known as the COVID-19, has entered into Minnesota. There are confirmed cases in Ramsey, Carver, Anoka, and Olmsted counties. These cases are proof that the virus is moving through the state of Minnesota as predicted. Here on the Mille Lacs Reservation, we are working closely with the Department of Health and Human Services, Emergency Management, and the Tribal Emergency Response Committee. We continue to monitor those cases, working closely with the Minnesota Department of Health and Indian Health Service to ensure we have the most up-to-date information and are prepared to care for our community in the event of a potential outbreak. With new cases expected to be reported as the virus moves through the state, we want you to know that the state of Minnesota overall currently remains at a low risk level. While this virus is cause for all people to be aware and diligent at self-care, there is no need to be alarmed. Because the virus has similar symptoms of the cold and flu, it can also be spread much the same way, such as being close in proximity by an infected person who is coughing or sneezing. The symptoms of the coronavirus are fever, coughing, and shortness of breath. According to the CDC, there are groups of people who have a higher likelihood of becoming ill more so than others if they contact the coronavirus, and will have a harder time fighting it off. People with diabetes, people with lung disease such as asthma, lung cancer, or emphysema, people with heart disease, people with suppressed immune systems, such as those who have received an organ transplant or those receiving chemotherapy, elders over the age of 60, and those who have other serious chronic medical conditions. The easiest way to prevent getting sick yourself is to stay away from people who are ill and practice good hand washing. We encourage you all to practice the following precautions. Washing your hands often and well. It is recommended to sing the ABCs, count to 30, or happy birthday twice. Use hand sanitizer with 60% alcohol or more when you are unable to use soap and water. Please don't rely on the hand sanitizer to be your only form of cleansing your hands. Keep heavily touched items clean. Surfaces that you use every day. Keep your house clean, but most important, your remote controls, your phones, your doorknobs, things that you use every day, utensils that you're eating with, please wash them right away. Please distance yourself from people who are sneezing and coughing. Coronavirus is contacted by coming in contact with respiratory droplets from those infected and close contact within 6 feet for 10 minutes or more with that person. Stay away from heavily populated areas, conferences, meetings, and limit travel. If you have any flu-like symptoms, please isolate yourselves from elders and others with underlying health conditions that make them more vulnerable to this virus. Those are the ones we talked about with lung disease, diabetes, asthma, anything like that. If you are experiencing any symptoms and you are concerned you have been in contact with someone who is ill, we encourage you to distance yourself from the elders and others who are at high risk and immediately call your doctor or the Nayashin Clinic. The Nayashin Clinic is prepared to answer any questions you may have, or if you are experiencing any symptoms, please do not hesitate to contact them during the regular business hours. And please remember that we're all in this together. We need to do everything together possible to stop the continued exposure of the coronavirus. And please know that the Mille Band of Ojibwe, Health and Human Services Department, along with the Minnesota Department of Health, are doing everything we can to make sure that our community is safe. And we will be updating you frequently on any new information that arises. Crystal is going to demonstrate proper hand washing today for everybody. Step 1, turn on the faucet, wet your hands, apply soap, lather your hands by rubbing them together with the soap. Lather the back of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. Hum or sing the happy birthday song from the beginning to end twice. Rinse your hands well under clean running water. Dry your hands using a clean towel or air dry them. Please throw away your towel and get a clean towel to turn off your water faucet. That's it.
I'll go Buzu, Awana Inhigaz, Monty Frank with Tribal Emergency Management. We're here today to make sure that we inform the Mille Lacs Band community members of what is going on with the COVID-19 response. Remember, number one, we want you, number one, to cover your cough and your sneezes. Do this with the tissue. When you're done with the tissue, make sure you throw that tissue in the garbage properly to do that. When washing your hands, it was stressed you want to wash your hands for 20 seconds. And that's a thoroughly washing your hands, all surfaces and in between your fingers to do that. We want you to avoid touching your face. We know you've heard that through the media. We know you've heard that on the news every night, but we're stressing it here for the Mille Lacs Band also. We're also saying if you are experiencing cold-like or flu-like symptoms, to please stay home. Avoid close contact with people who are sick. That could be in your family or in the community. People always ask us, should I go and get a mask or should I wear a mask? We are stressing you should only wear a mask if you are really sick. We're telling people that surgical masks are readily available for the public, but are not really effective at all for dealing with this type of health concern that's affecting the nationwide with the COVID-19. Dust masks also do not filter out any type of health-related viruses as in the COVID-19. People also wonder, should I be wearing any type of gloves? Gloves are not effective in preventing illnesses. Germs on hands and touching surfaces are going to make you sick more than with the gloves. Washing hands again well and avoiding touching your face is the truly most effective method of preventing illness. Please keep advised that Tribal Emergency Management, Tribal Public Health, and the Tribal Emergency Response Committee is monitoring the situation and will bring you information as we get it available to us. Many community members are asking, what is the Mille Lacs Band doing in preparing for the possibility of COVID-19 affecting our community? Be aware that the Tribal Emergency Response Committee, along with Tribal Public Health and Tribal Emergency Management, are routinely on phone calls from both Indian Health Services, state and local public health agencies. We are monitoring the situation through different social media sites, monitoring the questions that Mille Lacs Band members are posting out there. We're also looking at our response efforts internally. Be aware that the Tribal Emergency Response Committee is made up of all commissioners, public safety, and public information officers. If any decision is needed to activate or respond to a possible COVID-19 situation, the TERC would then direct staff and different departments in their response effort. Please always be advised that the social media sites will be updated by the Tribal Public Information Officer for any additional information regarding response or monitoring efforts made by the TERC or by the Mille Lacs Band of Ojibwe.